The Andrew Yang campaign recently released their healthcare plan, and it might quite possibly might be the worst healthcare plan out there of the kind of more top tier Democrat Democratic candidates that are running for president, because it doesn't even include the public option like Joe Biden and Pete Buttigieg's plan, which is really interesting because Andrew Yang has said that he believes healthcare is a human right, and he supports the spirit of Medicare for all, but it's not realistic to eliminate private insurance in his opinion, which proposals like Bernie's and Jayapal's actually they don't eliminate private insurance, they just eliminate it for duplicative care. Private insurance would still exist for, things like elective surgeries, cosmetic surgeries, that type of thing. So that's kind of a silly point to make there, Andrew. And then he also doesn't support the intra-party fighting that's been going on around, Medicare for all or Medicare for who or Medicare for all who want it. Then he also, wants to focus on the bigger problems that are driving up costs as well as taking lives. But if you don't support Medicare for all, then you're still okay with people dying due to a lack of health care, as well as paying more money, because the United States has the highest healthcare costs in the world out of basically any developed country, and we spend like twice as much compared to a lot of other countries that have universal health care and a lot of these a lot better health outcomes as a result. So if you're really concerned about driving down costs and saving people's lives, Andrew Yang, you would be supporting Medicare for all. That's the only way to do it. You're not even offering a public option, so you're okay with the private health insurance companies still existing, still rationing care, still padding, the executives' pay and their bonuses while people are dying due to lack of access to health care. So you can't have it both ways. And you say you support universal health care. Medicare for all is the only way to do that. Through what you're proposing, there will still be millions of people without health care. So your proposals have basically this six-pronged approach in his proposals, I should say. So the first one is negotiating drug prices. That's obviously good. The government would be able to lower prescription drug prices by negotiating the price for them with the drug companies, and we pay some of the probably the highest rates in the world for prescription drugs because we don't already do that already. So that's okay, that's a good thing. Talks about wanting to invest in innovative technologies to drive down costs, and again, that's not, those savings aren't going to be passed along to people receiving health care. Those savings are going to be reinvested back into these for-profit health insurance companies, as well as padding the executive bonuses and their pay. He talks about educating ourselves on preventative care, and again, it's good to be aware of how to take care of our bodies and our minds, but that's not going to fix the bigger systemic problem that we don't treat healthcare as a human right in the United States, resulting in 500,000 people going bankrupt each year, due in large part to medical bills, and again the 30 to 45,000 people that die each year due to lack of health care, or people staying in crappy jobs that they don't like so they don't lose their health care. He also talks about giving more flexibility to providers and having more health practitioners, and focusing on comprehensive care, things like mental health care, as well as diminishing the influence of lobbyists and So, diminishing the influence of lobbyists and the negotiating prescription drug pricing, those things are good. But again, if we don't have universal health care, if we don't have, Medicare for all in some form or fashion, then these larger systemic problems are still going to happen. And Andrew Yang, how do you say that you view healthcare as a human right, but you don't support everybody having healthcare? You can't have it both ways. Either you believe healthcare is a human right and you support universal healthcare, aka Medicare for all type of plan, or you don't. It's simple. It's either one or the other. And you said you were concerned about driving down costs and saving people's lives. Medicare for all is the only way to do that. And for goodness sakes, you don't even support, the neoliberal centrist option of a public option. So you're okay with the private insurance companies still, causing those huge bankruptcies, rationing care, leading to people dying, and we still have, I believe, it's like 30 million people, or it's probably more than that, honestly, but tens of millions of people in the United States still don't have health care with this, wonky system that we have now. So if you're concerned with saving money, if you believe that healthcare is a human right, if you're concerned about saving lives, you should be out there, touting UBI along with, universal healthcare or Medicare for all as, some of the top things on your political platform. But you're not doing that because, you just have this rhetoric of saying you do support healthcare as a human right, but nothing in your plan, shows that. So very disappointing in your healthcare plan platform. Andrew Yang, you could do a lot better. And Yang supporters, very curious as to why you would support somebody like Andrew Yang over, a social democrat, a progressive, and Bernie Sanders, who has stood up in this case, for Medicare for all, at least since the 1980s, and probably, before that. We need to do everything that we can to get Bernie elected. He's our really only shot at, some really positive, transformative change that can and needs to happen in this country. But those are just my thoughts on Andrew Yang's nothing burger of a healthcare plan. I would love to hear yours in the comment sections down below. Peace.